In the last video, we have learned ICD-10 CM real-time live coding tips part 1, where we have learned nearly 35 tips in order to code ICD-10 CM accurately. So in today's video, again we are going to learn nearly 30 to 35 ICD-10 CM real-time live coding tips along with few other guidelines. So if you miss part 1 of ICD-10 CM live coding tips, so you can check our playlist here, ICD-10 CM real-time live coding tips. Here you will find the part 1 of ICD-10 CM live coding tips. After watching this session, if you feel this video is helpful and you are able to use this video in your live coding, please click on like button. Next, tip number 35, status codes. So basically, when do we use status codes? As all of us know, mostly for status codes in ICD-10 CM, we will use Z codes or G codes. In order to code these status codes, patient needs to have complete removal of the organ. For example, patient is having previous breast cancer, and in the surgical history, you will see mastectomy. So mastectomy means removal of the breast. So that time you can use it as personal history or history of breast cancer. So what is the key thing here? If you want to code G codes, patient needs to have the surgical removal of the organ. So then that time only you can use G codes. For status, don't confuse, we have few other G codes which we will use for other purposes. Currently we are speaking about only about status codes where patient needs to have complete removal of the cancer. So then only you can use G codes. Next, history of disease. Okay, so in history we have two G codes. First one is G85 for personal history of cancer. Next, G86 other history of other specified diseases. So Z85 and Z86 are for personal history, not for family history. Most of the time, if you want to code history of disease, you need to use G80 series for family history. For personal history, G85 as well as G86. Next, screening codes. So as we discussed previously, don't confuse, all G codes are not used for status codes or history codes. We have few G codes which will be used for screening. So like G11 to G13. So patient is suspicious. So my mother is having the breast cancer. I may get the breast cancer. So that she will come to the physician for screening. So screening means without any symptoms. So before the observation codes G03 to G04 when under observation. If the patient is came in for observation, we need to use G03 as well as G04. What happens after few surgeries? Patient needs to be observed by the physician or nurses for side effects of the previous surgery. So that time they will send patient to the observation. So that time we will use Z03 to Z04 series of G codes. Next, follow-up codes. So G08 to G09 for follow-up visits. So what is follow-up? Basically, during the follow-up, if the patient is having previous breast cancer, okay, so patient came in for follow-up whether breast cancer is reduced or not. So as patient had mastectomy for breast cancer, she wants to ensure after the mastectomy whether she is having any breast cancer or not. So that time we will use G08 to G09 for follow-up visits. Next we have aftercare codes G42 to G51 for aftercare encounters. So here we need to understand follow-up is different, aftercare is different. So aftercare means condition is still present. Next one is immunization. So for immunization, we need to use Z23 for vaccine encounter. So we need to use G23 for if the patient came in for immunization purpose and physician administered the vaccines. Next, genetic carrier. So Z14 for genetic carrier status. Okay. So next we have family history codes. As we have discussed previously, G85 and G86 are for personal history of cancer or any other histories. Okay. For family history, we need to use G80 to G84. Okay. Next, for organ transplant, Z94 status, T86 complications. For example, patient is having the kidney transplant. Okay, so which is a status code. So that time we will use G94. For example, patient had kidney transplant and patient is having complication due to that kidney transplant. So that time we will use complication code which is T86. That time we will not use G94 series code. Okay. Next, dialysis status. Okay. So G99.2. So dialysis depends. Or in the operative reports we will see it as renal dialysis. So that time we will use G99.2. And if the patient came in for dialysis, we need to use G49. So G99.2 is for renal dialysis status. G49 is for if the patient came in for dialysis. Okay. Next we have chemotherapy. Okay, if the patient exclusively came in for chemotherapy, we need to use G51.1. Okay. For example, patient came in for radiotherapy, we need to use G51.0 for encounter. And also, if anyone looking for medical coding jobs in UAE, USA and India, please join in a WhatsApp group. The group link is in the description of this video. Okay. And also, if anyone looking for same day surgery training, IPDRG training, SCC training, CCS certification training, send WhatsApp message to 707-526-3939. Next one, long term drug use, G79 codes. So most of the time we will use long term drug uses like diabetes medications as well as warfarin for anticoagulants and Plavix for antiplatelets. So for that we need to use G79 series for long term drug use. Next, obstetric history. Okay, if the patient is pregnant, we need to use G34 series. Okay, for BMI coding, we need to use BMI only with obesity diagnosis. So you can't code BMI without the diagnosis of obesity. Next, tobacco use. So if the documentation contains tobacco use, you need to use G72.0. Okay, if the patient is a former smoker, you need to use G87.891. So this is for history. Next is alcohol use. So for example, if the patient is having any type of alcohol disorder, we need to use F10 series. Okay, the documentation contains alcohol use, you need to use G72.1. I hope this session will be very useful for you. So if you like this session, please click on like button, and next week we will see part 3 of ICD-10 CM live coding tips.